All right, my friends, let's come back together. And if you could go to the chat and tell me your favorite flavor of ice cream, I'll know who's here. Chocolate, cookies and cream. I love it. Butterbean. Oh, man. Y'all are giving me the sugar. I'm jonesing for sugar now. Peanut butter and jelly. Yeah. Eskimo kisses. Yeah. Oh, yeah. There you go. Why limit it? Why limit it? Jennifer loves it with the right idea. Anybody ever heard of Bluebell ice cream? Down in Texas, Bluebell. Okay, I'm hearing that the audio is fuzzy. Let me do that. Is that better? I just dropped down the gain on my mic. Breaking up. Checking microphone. 1, 2, 3. Microphone check. 1, 2, 3. Still bad. Man, this is lame. Let me try one more thing. I dropped it. I dropped that. Is that any better? Power cycle, yeah, on my audio interface. Let me try that. Okay, I rebooted. That's better. Awesome. But see, y'all are still going on the ice cream. I've obviously, hold on one sec. My mind is freaking out. I've obviously touched a nerve with the ice cream. So let me ask you back to, I think my question was about Bluebell. Anybody heard of Bluebell? That's what we do in Texas. It's this. Yeah, M. Carlisle loves Bluebell. Yeah, Bluebell. So the thing with Bluebell is that the creamery, the original creamery, is in Brenham, which is about 30 minutes from where I live in College Station. And what's so funny about that is if you work for Bluebell, if you work in that factory, you get to eat as much as you want. Like they literally have freezers filled with all of their ice cream, and you eat as much as you want. So that would not bode too well for me. So there you go. What book was I showing earlier for SEL? Someone asked. It was, hold on one sec. All right. And y'all, again, let me know if the audio gets wonky. I don't want to make sure. So it was probably one of these. So this is our curricula. These are samples of different grade levels of our curricula. That room 118 says, I sound great. Thank you, room 118. I feel deeply validated. Or these books. I mean, maybe it was one of my books. So that was those are the only books that I've shown that I can think of. So that was probably it. Okay, cool. Let's get to the PowerPoint, my friends. This is good stuff. Appreciate y'all. Mental health first aid in the classroom. This is a significant topic. So we're going to do a little breakout, but I'm going to teach a little bit, and then I'm going to have y'all go into groups. Man, check these questions out. What do you do with the student that has cut marks on her arm? And that's very common, and it's scary. What do you do with the student who says, I wish I were dead? What do you do with that? What do you do with a colleague who seems increasingly withdrawn and aloof? This is this content is just so relevant, and like we live in a day and age now where when you see something out of the ordinary, it's not paranoia to wonder, like, man, what does that mean? What's going on? Who's at risk? That's just the time the times that we live in. So these are all relevant questions, and in many ways they link back to mental health. So I'm going to cover, why does this matter? Why is mental health first aid important? What is mental illness? What is the ALGE model? The ALGE model is really where I want you to pay a lot of attention. I want you to always pay attention, but that's really, that ALGE model is really helpful, because you're thinking like, man, I'm a teacher. What am I supposed to do with this? Like, I'm not a trained mental health professional. I get it. And the good news is that you don't have to be a trained mental health professional to do good, to do something that's practical. That's why I love SEL and why I love mental health first aid, is because, like, you don't have to be a thoracic surgeon to perform CPR, but sometimes CPR literally can save a person's life. It really can. It keeps somebody sustained until other help arrives, is maybe another way to say it. So again, that's why I think this is so important. I want to give you practical strategies, things that you can do in your classroom that will be helpful when we talk about this. So back to the PowerPoint. Number one, why does this matter? This right here, educators are becoming the front line of mental health intervention. And here's what I mean by that. 20%, now keep in mind, this is pre-pandemic data. 20% of our adolescents had a severe mental disorder, not mild, not moderate, severe. And out of those, less than half were getting treatment. So 1 in 5 of our teens we knew was struggling with mental illness, and then half of them weren't even getting treatment for it. And that was in 2019, like that was before all of this pandemic stuff happened. I've seen different figures now, but it's creeped up to 30-35%. One survey said half of all kids, school-age kids, said something's not right, whether it meets criteria for a mental disorder or not. They were saying, I'm not doing well on the inside and it's impacting my academics. So again, like I said earlier, for those of us who are in the mental health field, like, we've seen this for years, but now we're at a point where we can't deny it anymore. Everyone is coming to accept that this is, not everyone, but more and more people are coming to accept this. And the great state of Michigan, again, from what I heard this morning, it sounds like y'all are on board. So that's cool. So that's the deal. That's where I did my postdoc at Brown Hospital, Brown Medical School. That was Alpert Medical School. And that hospital was called Bradley. It was an inpatient and partial psychiatric treatment for kids as young as 3 up to age 21. And anytime an ambulance or a police car or a minivan pulled into the Circle Drive, it was all hands on deck. And they were admitted here. And the general protocol was evaluate and treat, right? So and it was like OT, PT, speech, language, individual therapy, group therapy, family therapy, psychopharm, nutrition. I mean, it was a full complement of services. And we did our evaluations and then we treated. And that was the front line. I mean, that was where you went if you needed help. And again, that was over 20 years ago when I did my postdoc. Fast forward now, 2021, I think the front line of mental health intervention became public schools, because what we know now is that more and more kids are struggling with mental illness, as are adults, meaning their parents, meaning me, struggling with mental illness, and they're not going to get treatment. They're less likely to get treatment now, in fact, than they were back in 2019, because the needs have grown and the providers, the number of providers has not grown proportionately. And there's this whole, I don't know if I'm just going to go to the chat. Say yes if you know what Plinko is from the Price is Right, because I'm going to talk about Plinko here. Yep. Y'all know what Plinko is. Cool. So it's this game. So if you don't know what Plinko is, you obviously aren't watching enough of Price is Right. So make sure to record that. But it's this game, and there's like all these pins, and you drop a chip and it goes ding, 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 and it just bounces randomly. And down here you have landing spots. and your goal is for your chip to land where it's like free car, or new furniture, but the odds are against you, because it goes just random back and forth through these pegs. That's Plinko. Let me describe for you the mental health Plinko. This is true in Texas. It's true anywhere, I think. So let's say you're a parent, a concerned parent, and like, man, I need to get my kid help. Here's the deal. Step one, you got to call a clinic. So you make the first phone call. The first Plinko, the first fork in the road is, does the clinic even call you back? A lot of times you're not even going to get a call back. For my clinic, we have 30 providers, which is pretty big for an outpatient mental health clinic. And a lot of times parents will say like, man, you're the only one that even called back. So the first question is, do you even get a call back as a parent? And most of the time you're not, because they're too busy. Second one, let's say you get a call back. Then the next question is, do you have a provider that even has openings? Yes or no? The answer is usually no. There's an 8-month wait list. Okay. Next one. Do you have a provider that has an opening that also takes Blue Cross or Medicaid or TRICARE or whatever your thing is? Then probably not, because most providers are sick of dealing with managed care, and it's private pay. It's cash only. Okay. So then let's just say that you call somebody, you get a call back, there's a therapist with an opening, they do take your insurance, and they can get you in, which that right there, like that's 5 stars that usually don't align. Then the next question is, okay, well, does your kid have somebody in the family that can go pick them up at school, take them to the therapist, sit in the waiting room for an hour, take them back to school, and then get back to their job without getting fired? Probably not. And that's why I started doing a lot of SEL work about 5 or 6, 7 years ago, 10 years ago, really, was because we as outpatient therapists, psychologists, and licensed professional counselors, and LMSWs and LPCs, all that, like, we know that the kids that come into our clinic, they need help, but they're not the ones that need it the most. The ones that need it the most, they're never going to have access to outpatient therapy. So the law does not say that if a kid has a mental disorder, they have to get treatment. The law doesn't say that. The law does say if that kid is school age, they have to go to school. And so that's where we end up with this dynamic here, that public schools now the front line of mental health intervention. As scary as it sounds, it's true. Your classroom is the front line of mental health intervention. You're it. And I get it. Like you're saying, wait, Adam, look at my diploma on the wall. Look closely. It says, Bachelor of Arts in Education or Master of Science in Education. Nowhere on that diploma do you see licensed professional counselor, mental health, anything. And you're telling me I'm it, and I'm supposed to deal with these kids that are coming in that have all of this emotional trauma and overwhelm. I mean, yeah, basically. And so if you feel overwhelmed, if you feel scared, intimidated, I understand. Yes, you are free to feel that. Absolutely. And there's a reason for that you feel that way, because in many ways, the school system is being asked to do things that it was not originally designed to do. Thank God for states like yours, Michigan, where they're recognizing this need and not just telling you need to, but funding actual interventions. That's great, but that's not happening in every state. Some states are still in deep denial about that, and they think, nope, it's a parent's job. They need to go get them a therapist. Like you could just go find one at Walmart, and it just doesn't work that way. So that's the deal. That our classrooms are now the front line of mental health intervention. So the purpose of this module, it's not to make you a licensed anything with mental health. You're not going to be able to start therapy or anything like that. It's just to give you a basic toolkit. Something practical is better than nothing at all. So one thing you've got your SEL toolkit, but this mental health first aid is another big piece of it. So let me go back to the PowerPoint. Why is first aid important? Well, I think just decrease stigma. There's this thing about discussing a skin knee versus discussing depression. And let me just say, as a survivor of trauma, I still struggle less with depression, but I still struggle with anxiety. I still take medication. I still have a therapist, and like I said earlier, my first session, my keynote, man, when I was in the 80s, nobody, like, you didn't even admit that you were depressed. Like, no one would, not just boys, girls would. Nobody talked about that. There was so much stigma. And now as an adult, I talk, maybe I overshare about my struggles and the jokes I make about my medication and my therapist and all that. Like, but whatever, I'm going to talk about it. And the thing is, like, I remember when my daughter Maya, when she was a teenager, she was struggling, and in my church, there's this, we have a time where we can stand up and just share with a group, like, what are your concerns? How can we be in prayer for you? Right? It's a very Christian thing. And I stood up and said, hey, my daughter's struggling, appreciate all your love, thoughts, prayers, whatever energy, whatever good juju you can send our way, man, we'll take it. And she got a lot of depression, yada, yada. And afterwards, this woman came up and said, oh, thank you so much for sharing that. That was really bold. And it just broke my heart. It was true what she said, but it broke my heart because I thought, if I'd have stood up in front of that group and said, hey, my daughter's got strep throat. Hey, keep her in your prayers, man. She's not doing well. We may go to a doctor and get medicine. No one would have blinked an eye, like, oh, okay, no problem. Yeah, we'll keep her in your prayers, or anything like that. But if you say depression or anxiety, oh man, that's so huge. Thank you for sharing. That was very bold of you. And it just speaks to the continued stigma we have around mental illness. And it's really sad. It's really sad. So the more we talk about mental health, the more we have classes like this, and the more we make this normal, the less stigma there will be. Number two, we're going to move from a reactive, which is a Western model of intervention, to Eastern, which is prevention. So Western is reactive, Eastern is preventive. So here's what I mean by that. Western model medicine, broadly speaking, sees the body as a machine. It's very mechanistic. So like a mechanic, if the car doesn't work, you take it to the mechanic, and the mechanic either fixes the broken part, replaces it, or removes it if they can. And that's sort of the Western model of medicine. It's like you do your thing until your body breaks, and then you bring it to your doctor, and the doctor either fixes it, removes it, or replaces it in some form of that. That's a very mechanistic approach versus Eastern medicine, which is much more preventive. In Eastern medicine, the body is not viewed as a machine, it's viewed as a garden. And so the idea with gardening is, no, you don't wait until the weeds grow. You nurture the soil, you till the soil, you take weeds out as soon as they pop up, and you make sure that the soil is rich and nutritious so that everything you plant will grow. Like you preventively, proactively create this environment that is conducive to life rather than waiting for things to get bad and then intervening. We need both. We need the Western model and we need the Eastern model. The problem with Western model is it's, again, forgive me, I know I'm using a lot of masculine, feminine energy, but the Western model is very linear. It's very masculine energy. The Eastern model is very feminine energy. We need both. So the more we talk about mental health first aid and prevention, not like, what do we do after someone has brought a gun to a school? Like, we need to have that conversation, but like the conversation now is like, well, what do we do to even prevent that? And of course, SEL is a big part of that. So that's another reason I think it's so important for us to talk about it, is because it helps us get past reacting to trauma and preventing trauma before it even happens. Next one, we want to make maintaining mental health accessible. I would love for there to be as many mental health providers as are physical health providers. As many pediatricians, I would love for kids to have that. And the more we talk about this, the more it's going to spur interest in the field. Up and coming college kids are going to want to study the field and go into graduate school and become providers. So the more we can talk about it, and the more we illustrate how necessary this is for culture, I think we just start creating the systemic change. And so that's all great. So those are the reasons that I think dealing with mental health is in this course is so important. So what we're going to do now is we're going to go to your groups. The person whose birth date is latest in the year, closest to December 31st, you're going to go first. And I just want you to share, like, what concerns do you have? Like, when you're in your classroom, what do you see that really makes you feel like, oh my gosh, I'm not prepared for this? Is it the depression? Is it the anxiety? Is it parents that seem disengaged? Like, what's going on in your classroom or in your role that is just really worrisome to you? Okay, so let's go to our breakouts and I'll give you 10 minutes. Okay, let's give our 1 minute warning.
It's being recorded. You said. So then he asked me what went on, and then
Okay, welcome back. Welcome back, everybody. I would love for someone to unmute yourself and share with me when you think about mental health in the classroom and mental illness, what thoughts and feelings come up for you?
That these kids have way too much on their shoulders that should not be put there.
Anyone at all, feel free to jump in.
I mean, for us here in the Upper Peninsula, there's a huge
Okay.
lack of resources for the kids.
Fear, I see in the chat. Does anyone want to unmute and speak out?
Well,
People are speaking.
put the
I'm
word-
not hearing it.
I put the word fear.
I'm not hearing them.
Can you hear
So, y'all, okay. Y'all can hear me. Okay, sorry. Yeah, I'm not hearing you for some reason. Yeah, and my audio is on. But okay, go ahead. Go ahead. Whoever's speaking, I'm going to give you a minute. Keep going and share out. Sorry.
Oh, I mentioned fear because for a couple of reasons. First, it's just if there were some type of physical altercation because of what's going on with the child, but also because I feel not properly trained
Mhm.
to handle it. And I did have an experience where I had a older teenager in my classroom with a head injury, brain injury, and she did fine, and then all of a sudden one day she almost hit me, and the only thing I stand my ground, and I guess the bluff worked, and she walked out of the room. But yeah, I think we as teachers are afraid that we're going to get hurt
Yeah.
or something.
And I would imagine too, thank you for sharing that. I would imagine too, it's not just that you're afraid to get hurt physically. I would imagine there's some level of like being afraid you're going to get hurt legally. Like you don't know what to do. And what if you do something and then the next thing you know, that family has an attorney, you know? I mean, that's scary when you think about that. Thank you for sharing that. Anyone else want to share? I was able to hear that time. So I think my audio is good now. And I think I've given you the freedom to unmute on your end. So anybody else want to share?
I just said that I feel that there's so many younger parents now that maybe haven't been parented well themselves.
Yep. How does that play out in your reality? Like what do you see happening?
Behaviors,
Mhm.
non-compliance, just sad kids.
Mm-hmm. Yeah. Yeah, absolutely. Absolutely.
And so much drug use,
Mm-hmm.
for being such a small area.
Mm.
There's just so much drug use.
Yeah. Yeah, it's difficult. It really is. And that it reminds me of the area I grew up down in South Texas. We were poor, everybody was poor, and there were a lot of drugs crossing the border even back then. And it just did not lend itself to good educational dynamics, good family dynamics, good relational dynamics. I mean, there was just this whole setup that was really difficult. So thank you all for sharing all of those things. Very valid concerns. I'm going to go back to the PowerPoint, and then let me also say my screen shifted. I want to make sure that is my screen still spotlighted for you, because I want to make sure that you can see the PowerPoint. So just go and say on the chat, say yes, Adam. Okay, cool. Thank you, Katie. Thank you, Seth. Appreciate that. Okay, good. So let's get back to the PowerPoint. We talked about why it matters. We talked about why it's important. What is a mental illness? Because, I think it's an important point to make, because every one of us on any given day could wake up feeling a little sadder than normal, a little more stressed than normal, maybe a little more hyperactive than normal. At what point is it clinical? Like when is it actually diagnosable? So I'm going to talk about that now. A mental illness is a mental illness when that book says so. So that's the DSM-5. And if it's not in there, it's not a disorder. And if it is in there, then it can be a disorder. So case in point is I never have done any kind of custody evaluations as a psychologist, because they are just, man, they suck the life out of you. But there's this thing in custody evaluations called parental alienation syndrome. And you have attorneys that like, we need you to test this kid and prove that diagnosis. Well, there is no diagnosis, because if you look in this book, you're not going to find parental alienation syndrome. And what's in the book changes from year to year. So for example, here's another example. 5 years ago, we had this thing called Asperger's disorder. That was for a certain kind of autism spectrum disorder. Typically, we considered it on the mild end of the spectrum. And then so that was the DSM-4, DSM-TR. When it got revised into the DSM-5, the folks, the APA and others decided, well, let's just get rid of Asperger's disorder and call it autism somewhere on the spectrum from mild, moderate to severe. And so now Asperger's isn't even a thing anymore, and if you were previously diagnosed with Asperger's disorder, that made you very, very angry. You know, like, what do you mean it's not there? I have it. What are you talking about? So stuff comes and goes in and out of that book. Again, perfect example. In, I think, the first version of the DSM, homosexuality was a mental disorder. You know, it's not now. I think there's gender dysphoria now. So there's a lot of it that's political. There's a lot of it that's science. There's a lot of it that's just weird. But if it's not in this book, then it's not a disorder. And so if it is in the book, then some things have to be present. Number one, the symptoms have to be present. And number two, they have to negatively impair life functioning. Those are significant because a lot of times, hold on. Let's see. Audio is choppy. I want to make sure the audio is good. I apologize for the technical difficulties. Is the audio good? Say yes or no. It's good. Okay, cool. Thank you, Holly. Okay, it's good. So the symptoms have to be present and they have to impair life functioning. So here's another thing that I see in my 20 years of clinical practice. My kid can't sit still. They're really gifted. They could be an A+ student, but they're making Bs. We want you to test them and give us a diagnosis of ADHD. Okay. I'm sorry, I keep getting messages that some of you are having problems with the audio and some of you are not. So I'm going to move forward then and assume that enough of you can hear. Yeah, Katie says it's fine. Okay, so if it's not on my end, thank you. Okay. And parents get so angry because they'll say like, no, you don't understand, Dr. Sines. My kid has attention problems. They could be an A+ student. Okay, but back to this, like the symptoms are there, but they're not impairing life functioning. And so what's life functioning? For a kid, it's two things. Can you initiate and sustain age-appropriate relationships? And can you make satisfactory academic progress? That's what a kid's job is. Make satisfactory academic progress and make and sustain age-appropriate relationships. This kid was doing well socially, you know, on the cheerleading squad and, you know, making Bs when they could be making As. Satisfactory academic progress means, are you passing or not? You know, and if you're not passing, has the school offered interventions, you know? And so even if you don't diagnose ADHD, if your kid's a B student, they could be an A student, but they're so distractible, they're making Bs, that doesn't meet the diagnostic threshold. So the symptoms have to be present, number one. And then number two, there has to be evidence that it's impairing life functioning. So back to the thing I alluded to earlier about how do you know when it's just depression, you know, you're just having a bad day versus when is it clinical? Well, it's the symptoms are present day after day after day, and they're so bad, you can't live your life. You can't go to work. Your marriage is falling apart. You can't parent your children. You can't manage your money. You're not getting out of bed. That's when it's clinical. So those are two important things to think about when you think about that. Like when, you know, again, when parents come to me and they're like, oh, Dr. Sines, you need to diagnose my kid. Well, I will, you know, if the symptoms are present, number one. And then number two, if they're impairing life functioning. If those things aren't present, I'm not going to give a diagnosis. So what are the areas covered by that book, the DSM-5? Mood disorders, and those are things like depressive disorder, I think a joke. And the reason I say that is what happened was in the late 90s, I think it was Ross Greene wrote a book called The Bipolar Child. And then after that book came out, everybody and their freaking dog had bipolar disorder, and it was so overdiagnosed. And that's a big diagnosis, especially to start giving to little kids. And so then you had all these kids on these huge, like, mood stabilizing drugs like lithium, and it just wasn't good. So then when the DSM-5 came out, they said, well, man, that bipolar thing, we need to rethink that for kids, right? And so they said, well, instead of calling it bipolar disorder, let's call it disruptive mood dysregulation disorder. And then they made the criteria pretty loose. And so anyway, I say I don't like it because it's just a weak diagnosis, in my opinion. Some kids do have true mood dysregulation disorders, absolutely, but it's soft. So those are mood disorders. These are anxiety disorders, generalized anxiety disorder, reactive attachment. We see that a lot in kids that have trauma, foster care, adoption, that are adopted internationally. PTSD, that's one that we're common with there. And it's interesting on PTSD, there's the criteria on PTSD have been broadened to include exposure to secondary traumatic stress. So if you are a trauma-informed worker, meaning you do like, you're a medical provider and you do ER work, if you're an EMT, if you're a nurse in a hospital setting, if you are a CPS worker and you do family visits, if you work with kids that have emotional abuse, you are experiencing secondhand trauma by your exposure to their trauma. It's sort of like a secondhand smoke effect. And that's a legitimate cause. Secondary stress is a legitimate thing, and especially in workers who work in like law enforcement, firemen, firewomen. It's a real thing. So just another expression of that. So let's go. Obsessive compulsive disorder. That's a common one. We see that OCD a lot. Another anxiety, there's phobias, specific phobias, and one that we see in schools a lot is school phobia, school avoidance. And, I said this before, but one of the worst things we can do for kids that have school phobia is keep them at home and do homebound instruction. I mean, sometimes you do, but as a general rule, keeping kids away from school that have phobia it's not best practice. There's just a ton of research. Next one, substance abuse disorder, alcohol dependence, cannabis, opioids, amphetamines, all of those are disorders. Feeding and eating disorders mostly impact women, girls, anorexia, bulimia, DSM-5 added binge eating disorder. That was either in the DSM-4 or the DSM-5. I think it was DSM-5. So those are eating disorders. Let's see, let's move forward. Neurodevelopmental disorders. And this is where schools are like, if my kid has a neurodevelopmental disorder, I want them in a public school. I mean, period. Unless I have a bazillion dollars and I can afford to find individual outpatient interventions, and some people can, but if I don't have those kind of resources, schools are in my opinion, the best place for these interventions. Autism spectrum disorder, learning disability, intellectual disability, communication disorder, emotional disturbance. This is where schools are just stacked with wonderful, wonderful resources. Three cheers for special. There's one cheer for special ed. Okay. So that's just to give you a sense in that book, what's in there. It's mood disorders, it's anxiety disorders, substance abuse, eating. Then we can talk about personalities. We don't diagnose personality disorders in kids usually. Things like antisocial personality, by borderline personality disorder, the schizotypal personality disorder, because the thinking is that someone's personality really isn't established until they're 18. You can show features of those personality traits as a teenager, but we typically don't give those diagnoses. We used to call those axis 2 pathology. We typically don't diagnose that until someone's 18. All right. So what does it look like on a campus? If a kid's got a cold, we know what it looks like, fever, aches, chills, tiredness, sore throat. But what does this look like in a classroom? These mental illnesses, mood disorders, common symptoms, an unusually or pervasively sad mood. Loss of energy, anhedonia, and hedonism is you just want pleasure. Anhedonia is without pleasure. And so what that is, let's say your kid loves baseball or they love riding their bike. And it's like, oh, let's go play baseball. I don't want to, I don't want to ride my bike. I don't want to play my Xbox. That's anhedonia, when people and kids aren't taking pleasure in the thing they normally take pleasure in, anhedonia. Social withdrawal, excessive sleep, irritability, expansive, aggressive mood. That could be an indication of a manic or hypomanic disorder. So those are symptoms of mood disorders. Anxiety disorders, physical complaints, we call that somatization. And so again, remember I told you that I think stress is killing. The data show that stress is killing us. There's this really intricate connection between what our body is doing and what our mind and emotions are doing, and specifically what our gut is doing. And there's this old phrase like, man, I can't stomach this. And that's sort of a euphemism for like, this is too much for me. I need to tap out. Like this is too much. stimuli. I can't stomach this. And there's so much truth in that, because when we're stressed and overwhelmed and we're experiencing anxiety, it destroys our gut biome. It destroys our ability to digest food. All of the good bacteria get cannibalized by adrenaline and cortisol, which is what's produced when we're in stress mode or anxiety mode. And once that destroys our gut bacteria, we're done. Then we can't digest food the way we once did, specifically processed carbohydrates and dairy. And then our body starts to interpret, like when we eat those things, it interprets that as a pathogen and it triggers an autoimmune response, like danger, danger, danger. And then we have these autoimmune issues that cause inflammation, joint swelling, aches and pains, stiffness. It's miserable. It's a miserable sequela of physiological symptoms that can be rooted in anxiety. We know that what happens in our gut is directly connected to what happens in our brain. In fact, there's a lot of emerging research calling our gut our second brain. So my wife and my son both have celiac. Like they absolutely cannot do gluten, and it messes them up even when there's cross-contamination. And with my son, he's 20. He is, if he just gets exposed to gluten, he's going to have GI problems automatically. But for 2 or 3 days, his anxiety is going to be spiked. We just know it. So somatization is the body saying there's something wrong emotionally. And typically what's wrong emotionally has to do with anxiety. So that's a huge symptom of anxiety or stress. It's functionally the same thing. Racing heartbeat, chest pain, blushing, dry mouth. That's the body taking all of the energy of anxiety and trying to burn it. Racing thoughts, pressured speech, feeling on edge, avoidant behavior. These are all indications of anxiety disorders. Substance abuse, slurred speech, smoke, bloodshot eyes, paranoid, limited visual, verbal interaction, avoidant behavior, all symptoms of substance abuse. Moving forward, feeding disorders, unhealthy eating, vomiting, using laxatives. These are all symptoms of feeding and eating disorders. All right, now what do you do about it? So again, big picture is we've talked about this idea of mental illness. We know kids are coming into our classroom with untreated mental illness because it's a question of access. Not everybody's going to get in. That leaves them in your classroom, and it leaves you scared, frankly, as you should be, because maybe you didn't know this is what you're signing up for. What do you do about it? What can you actually do about it? So I'm going to talk you through, this is called the ALGE model, and this is from the National Mental Health First Aid class. It's a great, that course is a great course, highly recommend it. So let's talk through the ALGE model. What is it? It's an acronym, and it stands for, number 1, assess the risk of harm or suicide. 2, listen non-judgmentally, give assurance and information, encourage appropriate professional help, and encourage self-help. So I'm going to go through and just kind of talk you through, what does this look like what does this mean for you as a classroom teacher? How do you actually do these things? So let's go to the first one, assess for risk of suicide or harm. It says I'm going to review that at the end of the session, but I'm not. So that was one of the first questions that I posed, was like, what do you do with a kid that says, I'm going to kill myself? My thing is, like, I never take that lightly. When a kid says, I'm going to kill myself, and I would establish that in my classroom from day one. I mean, day one's already gone, but just say, hey, listen, guys, here's the deal. A lot of us are struggling. Like, I struggle with depression. I struggle with anxiety. And I know a lot of you are, and it's not just y'all, it's everybody in the country. We're all dealing with we've been through a lot. But here's the deal. Like, if you come into my class and say, man, I'm just going to kill myself, don't joke about that, because I'm going to take you seriously. And I'm going to come up and ask you about if you have a plan and if you have intent and how would you do it. And you're going to say, oh, miss, why are you getting freaked out? Why are you overreacting? We don't take that serious. We don't take that lightly in this classroom, and just let them know, like, don't fiddle around with that language. Don't say those words. Like, you don't walk into a building and say, fire, fire, fire. Well, you don't walk around saying, I'm going to kill myself. You don't walk around saying, I'm going to shoot this place up. Like, you just don't go there, and if you go there, I'm going to take it seriously. So just establish that from the beginning, or right away in your classroom. assess for harm. And so once you establish that norm in your classroom, then when a kid says, I'm going to kill myself, then you go in and you assess for the presence of suicidal ideation. I'll come back to that in a minute. But the whole point here of this, assess for risk of harm, is when a kid says, I'm going to kill myself, don't take it lightly. Like just establish the culture that, like, we're not going to say I'm going to kill myself. We're not going to say I'm going to come up to school and shoot the place up. We're not going to say I'm going to bring a bomb to school. Like, we're just not going to go there, because if you do, we're going to respond to that. Okay, so that's assess. The next one is listen non-judgmentally. And I talked about this when I talked about the stages of escalation. Listening non-judgmentally is just listening, and you're not saying, well, whose fault this is, or, well, you shouldn't be angry. You should be this, well, what do you expect? Like that kind of stuff. It's not helpful. Just listen non-judgmentally. And another way to say that is listen with intense curiosity. That's it. Be curious about that kid. Like, help me get into your world. Help me understand. Listen non-judgmentally. Don't invalidate feelings. We talked about that last time. Don't assign fault or blame. Do ask questions. How does it make you feel? What might you do about that? What are you thinking right now? Do express gratitude for the trust. Man, if some kid comes to me and says, hey, sir, can you talk for a minute? Like, I'm not doing well. And they lay out the groundwork for me, and they tell me, man, I want to make sure that I say, hey, listen, man, thank you so much for talking to me. Like, that's huge that you trusted me. Thank you. Thank you. And I just want you to know I'll be here anytime. If we have to schedule time, I'll make time for you to talk to me. So thank you. And it's just a great way to honor kids. Give reassurance. Don't give false reassurance. Don't worry, everything will be okay. Listen, man, unless you have a time machine and you've gone 50 years into that kid's future and you know for a fact that everything's going to be okay, don't say everything's going to be okay, because what if they go home and their parents gone? What if they go home and there was a homicide and there was an arson? Hey, I thought you said everything was going to be okay. So don't say that, man. And we say those things because we're trying to help, but it's just not helpful. Time heals all wounds. It doesn't. Treatment heals wounds. Time does not. Time is a part of it, but time alone doesn't heal wounds. And if it did, how did we end up with so many dysfunctional adults in this world? So clearly, counting me, clearly time alone does not heal all wounds. So these kind of platitudes, like, you just don't know what to say. And so you say something, everything's gonna be fine. Time heals all wounds. If you don't know what to say, then say, I don't know what to say. That's the safest thing to say. I don't know what to say, but I'm here with you. Thank you for sharing. So you don't want to give false reassurance. Say this, say, man, I watched this. I did a video conference with this guy named Adam, man. And that dude, he had a screwed up life and he came out of it. And if he can come out of it, I bet you there's hope for you. He's still a little wonky, but he did okay. So watch his TED Talk, do that. Give reassurance. Let's see. Yeah. People who have struggled with this have been able to overcome. That's reality-based light at the end of the tunnel. That's real. That's not, don't worry, everything's going to be fine. This is an empirical statement. Give information to the child and to the parent, medical, psychiatric. You can send links to a parent if they ask you for doctors or outpatient mental health therapists. If they ask you, don't go and, like, I mean, I know most of y'all know this, but in case you haven't heard this, don't go to a parent and say your kid has ADHD, you need to go get him medicated. Like, unless you're a psychologist and you can render that diagnosis, A, and B, you're so good that you can do it without a formal assessment, then don't say that. Don't say your kid's depressed, get him into therapy. You might just say, like, man, it seems like Adam's struggling. Like, is there anything I can know about that would be helpful? And if they say, yeah, he's like, if they say, no, it's none of your business, then it's none of your business and shut up. But they may say, yeah, he's struggling. I don't know what to do. Well, okay, is there anything I can do to help? Well, I don't even know. Well, would it be helpful if I sent you some websites about patient provider? Yeah, sure. Or if they say, no, I don't want to hear about it, then that's the end of the discussion. Okay, back to the PowerPoint. Encourage professional help, physical, go see a doctor. Like, so much of our stuff, that's step one, is just rule out any kind of medical etiology. Food intolerance is a big thing. And then go to a doctor and look for psychological help, and then spiritual. And so let me talk about that, because again, I'm an ordained minister, right? And spirituality is very important to me. That doesn't mean you go to a kid who's struggling and say, well, do you want to come to my church and join my team? We're not trying to recruit team members to our team. That's not what this is about. It's about saying, if your family has some form of religious practice, this is the time to access that. If they don't, that's fine. But if they do, whether you're Christian or Muslim or Zen Buddhist, like whatever your thing is, go to those people and ask them, invite them into your world and ask, what does your what intervention does your religious ideology offer for your mental well-being? You know, I get real triggered. Like my history is Christianity. I don't sort of identify as a Christian anymore, but in different sects of Christianity, there's like, you know, there's no such thing as mental illness. There's no such thing as depression. You're choosing to be sad. And it just made me want to vomit. Sorry, I had to throw that. I'm done. Okay, here we go. Let's move forward. And then encourage other help. Talk to your family, find friends and their family. So if kid says like, man, my family, I don't want to talk to my mom or dad, you know, I've got a horrible family. Do you have a friend that's got parents that you can trust, that you feel good with? Well, go to their house if you can and get to know their family well. And then, okay, let's go back. So this is algae in summary. What can you do in the classroom? Number one, assess for risk of suicide or harm and make sure kids know that we're not going to joke around about like, I want to kill myself. And if you say you're going to kill yourself, then we're going to take it seriously. Listen non-judgmentally, give reality-based reassurance and information, encourage appropriate self-help, and encourage appropriate professional help, and then encourage self-help. And if there aren't them, create them. Those are the three most important things on assessing for risk of suicide or harm. You probably have a policy in place in your district for these, so keep that in mind. So it's we're coming to the end of the time. I'm going to go through this again. Now, let me conclude with this. This is what we covered. Why does it matter? You know why it matters now, because I think you did before. The more we talk about it, the more we destigmatize it, the more we make people aware of it, and the more we can increase awareness of the field. Why is mental health first aid important? For the same reasons. What is a mental illness? It's when the DSM says so. And then what is the algae model? It's just a practical way for you to have some kind of framework to understand how to intervene. Okay. Cool. Again, I sorry I rushed at the end of that. We're out of time. But if anybody wants to stick around and ask a question, I'm game. I'll play some jazz music to slide up for the algae model. Yeah, Chris, sure will. There it is. All right. Welcome back, my friends. Let's make sure we're all together. Go to the chat and tell me what you're going to have for dinner tonight. I said vodka martini. Pizza, nice. No clue yet. Yeah. Margaritas. I'm hanging out with Jess. Me and Lisa are going to have margaritas. Oh, spaghetti and red wine. Marcia, you're living it, man. I love it. Pizza. Fish fry. Whatever you can get on the road, I feel you. Taki. Dude, I'm a round of applause for Taki. Awesome. So Kay Ray, not trying to call you out, but I'm trying to figure out, is that an 8-point or a 10-point behind you? I like to hunt. Yeah.
Is that an 8-point or a 10-point? 10-point.
Oh, that's a great, man. That's awesome.
That my father-in-law shot that.
Oh yeah, cool. That was one of the first things I noticed. Okay, fish fry, Mexican, etc. Going out to eat. Okay, y'all have good plans for that. So I love it. So this last section is loving yourself well. This is from the book. That's why the PowerPoint looks different. It's from The Power of a Teacher. So this content is directly out of this book, which essentially is a self-care manual, holistic self-care. Let me stop. For those of you who were in the session before, I ran deep into the time and we didn't have time for Q&A, but it looked like y'all had some great questions. If you were in that session and you had a question that you want me to answer, let's honor that, and then I'll move into this next content. Any questions?
What do you do when the behavior plan says ignore comments like I am going to kill myself?
Man, I saw that. What do you do if it says that? That's scary. Like, I would want to know why that's the case. Well, here's what I would do. Is I would go to the LSSP, school psychologist, counselor, whoever is in charge of creating the behavior intervention plan, and saying, can we change that from saying ignore when I'm going to kill myself, ignore the kid when he says he's going to kill himself, and change the goal and just make it the student will find better ways to express their level of frustration. Because so what I hear behind that is like, oh, he says that all the time, don't worry about it. I just don't know that the right intervention is just to ignore it, because yeah, he's crying wolf, but what if one day there really is a wolf, you know? So I might go back and say, well, I guess the first thing I would do is honor the IEP because, or the behavior intervention plan, because that's what's in writing. And then the next thing I would do is say like, hey, can we rethink this? You know, because that seems like it's setting us up to, you know, for some liability. Again, what if we created a goal that said his behavior intervention plan is to increase his ability to vocalize his frustration using different language, you know, something like that. Yeah, great question. Thank you for asking that. Any other questions about anything? Mental health first aid. Using a diagnosis to excuse problem behaviors. My kid has ADHD, so they can't control their anger. Yeah, I mean, I would say to a parent, like if they said, well, my kid has ADHD, he can't control his anger. I would say, well, the good news, like, yes, I understand that the diagnosis and the symptoms associated with that diagnosis, it probably does make anger management more challenging for your kid. The good news is that we know that a lot of kids have ADHD and they've learned to regulate their emotion. And if it's possible for them, I believe it is possible for your son. So really excited about helping your son grow in his capacity to regulate his anger. That's what I would say. Yeah, what do I think when a kid is like showing a lot of drawings about guns and violence? Man, I think the phrase is get curious and not furious. So it's easy to look at that and say you shouldn't be drawing that, you know. So I remember when I was a kid, like I would draw pot leaves on everything, like cannabis everywhere. I would draw that, you know, and then I would draw the music that I listened to. And it was like a lot of death metal and dark stuff and Black Sabbath or whatever, you know, which back then was sort of like, you know, it was edgy music. And, you know, I had some teachers that would say like, that's the devil's music, you're going to go to hell. And I thought, well, at least the music will be good. Hold on, that, you know, I'm going to boo that. That wasn't from, I would say that though. You know, they would get angry. They would get furious about it. You know, like, man, you're a dope smoking loser or whatever. You know, and I understand as an adult, you see those and you get concerned, you get anxious, you get angry, you know, like you shouldn't be doing that. But instead of furious, get curious. Like, hey, so what does that mean for you? You know, I see you drawing guns and other violent images. What do you think and feel when you draw that? You know, I don't know. Okay, I'm just curious. If you ever want to talk about it, I'd love to hear. Those are really compelling images, and I'm just, you know, wanting to know you better. That's what I would do. I would get curious. My son, actually, he's 20 and he's struggled with depression throughout his life. And he's really drawn to, like, he's been drawn to dark comics, you know, and dark movies and dark images and art. And that's just sort of his way to communicate what's going on inside of him. Yep. Awesome. Great question, Joe. One last chance. Anything else? You can unmute yourself and ask if you have that capacity, or you can type it in the chat. Okay. So what we're going to do, oh, go ahead.
Can you hear me?
Yep.
I think a big frustration for me right now is I'm new into a district, and you know the mom, and I get it, like, you know, all of her kids have some sort of disability, and I almost feel like she feeds into that. And you know, so me trying to work with them, like I say the wrong thing, they run home, they tell their mom that this is what was said, and then it comes back at me where she's judging my character and my ability to do my job. And like, I don't want to feed into that. I just want to address the points that, you know, I'm having with them, because with the issues that I'm having with them have nothing to do with his disability. It's disrespect. And that doesn't come because you have a disability, you know, because you are told, you know, that the adults that are trying to work with you may not matter and don't know what they're talking about. So then I get, well, you don't know how to deal with a preteen with autism or Asperger's, or she will often say like with a specific learning disability. Well, no, his disability is in, you know, these three things. It's not in disrespectfulness, you know, so, and there's two of them that I'm, you know, dealing with. And so that makes it hard as a teacher to hear that and have it be a pattern, because she's done it with, you know, the counselor and the principal. And so that just makes it hard that way.
Yeah, that is tough. So what I recommend is number one, recognize that you as the adult are entitled to your emotion, and if that makes you feel frustrated and angry and cynical, you're entitled to that. Don't let anybody say, well, a good teacher wouldn't be bothered by that. I don't know about that. So number one, just know that you're free to feel what you want to feel. Absolutely. And then the second thing is I would wonder, how can I start communicating with this parent outside of these problematic interactions? So it sounds like maybe a lot of your communication is when you get misquoted by their kids to them. And that just creates a firestorm. So maybe you could reach out to them and say, listen, I'm grateful, for the opportunity to teach. And I want to be the best advocate that I can for your kids. It seems like a lot of our conversations, though, happen when I feel misunderstood or when I feel misrepresented by your children. And I would just want to make sure that we understand each other. Help me in a calm moment. You're thinking like in a calm moment, can we schedule a time, for me to come in, for you to come in, or come into my office hour or whatever it is. And I just want to hear like what you have in mind, how I can help and serve. They may come back and say, well, you can give my kid a pony, you can give him $1 million, you can shut your fat mouth and blah, 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 right? Back to that thing about young parents that maybe weren't parented well themselves. Like, okay, that wasn't helpful, but it was helpful because at least that way you've demonstrated to the parent, like, I really am trying to be rational here. I really am wanting to help. And this is just my offering. This is my strategy. I would consider that as well. Thank you for asking that. Awesome. Anything else? Okay. Now let's talk about this self-care module. This is my life. This is your life. Each spoke represents a major area. This is me about July 30th, after I've had my cup filled. This is me at Labor Day, right? Worn down, just worn down and depleted. Maybe that's you after your first day on contract. I don't know. But it just speaks to what well-being looks like. And so, many of you, one teacher told me one time, like, if I hear somebody else say self-care, I'm going to slap them. Like, I'm so sick of that topic. And I get it. I mean, that topic has just been so abused over the past 2 years, self-care. And, I've been to some self-care workshops over the time. And, I hear things like, well, you just need to treat yourself to a night's bubble bath, enjoy that piece of chocolate without guilt, And I'm thinking like, yeah, I mean, that brings a moment of pleasure. Like, you're going to get your serotonin triggered for a minute or two with that, but that really doesn't solve the deeper issue. That's just like a quick fix type thing. So when I think of self-care, I think of it holistically. This is my life. Each spoke represents a major area. True self-care is me being a good steward of my emotions, me being a good steward of my finances, my spirit, my body, my occupation. You can find other spokes to add into there, like family, relationships, but these are some of the core ones, So again, self-care to me means good stewardship of these areas of my life. It's sort of like, if you've got a car, when you're a teenager, you think, oh, all you have to do to take care of a car is you put gas in it. That's it, and then you get a car and you think, oh, okay, maybe I have to change the oil. But then after you've had cars for a while, you're like, no, gas is just the tip of the iceberg. I got to change the oil. I've got to replace the belts and hoses every so many miles. New tires, have the brakes checks. I have to have it inspected. I have to have insurance. And you realize that to keep this vehicle on the road, it's a lot more than just stopping at the gas station on Friday. And that's kind of how I think of self-care. It's just a lot more than giving myself a little bit of pleasure at the end of the day. It's this comprehensive thing. So loving yourself well means that you understand these are parts of your life, number one. And number two, you're going to honor yourself and prioritize practicing well-being in these areas. And the way it works is that our lives are dynamic. They're not static. And so we build self-care and then we're depleted. and then we build self-care, and then we're depleted. And it's just like a heartbeat, filled up, poured out, filled up, poured out. And that's what makes it sustainable. Is like one teacher, former teacher, she's an administrator now in the corporate sector. She said, I was a teacher and I loved it. For 5 years, I gave it my blood, literally gave it my blood, sweat, and tears. And at the end of 5 years, I was done. And she said, if only I had known that I had permission to take care of myself, I'd still be in the game. But nobody told me that. Nobody, they just said, kids come first, kids come first. And I put kids first and then after 5 years, I couldn't do it anymore. And that I just, man, I don't get that, it's like what I said earlier. Those who can teach and those who can't make laws for those who teach. And those who don't understand education and don't understand child development also don't understand that no matter what interventions you have in a school, if the teachers are tired and burned out, those interventions aren't going to be effective. Teachers or non-educators don't get that. And they think, well, you just go in there and do hard work. Well, yeah, whatever. Again, the best intervention for every kid is a healthy me. So put my mask on first. It's always the priority. And that's not narcissism. That's not self-absorption. That's an act of love to the people that are depending on me. So I'm going to talk through what wellness looks like in each of these 5 areas. And then I'm going to show you a wellness assessment you can take. And then I'm going to give you practical strategies to grow well-being in each of these 5 areas. So let's go forward. Occupational well-being, there are 2 keys. If you want to be well occupationally, number 1, have good community. Whoever called in earlier this morning, they talked about that. Like, man, I love my community. We support each other. We love each other. That's it. You don't want to do this in isolation. This idea that I'm going to show up as late as I can. I'm going to leave as soon as I can, day after day after day after day after day. I'm going to give them the minimum amount of me that I can give them and not get fired. And that's going to be my MO. That doesn't create occupational well-being. That's like working in survival mode, and it's not healthy. So I want to be connected. I want to share my joys. I want to share my struggles. I want to share my victories, everything with the people that I'm working with. And if you ask, I'll use an extreme example. If you ask a combat veteran who they're closest to, they're going to say it's the people we served with in combat. Well, how did you get so close to them? Was it the case that they took you to a beach and let y'all bond for 9 months together in this stress-free environment? And then you knew you had each other's backs, and then you could go into battle? Absolutely not. When you're in battle, the other person is all you got. You don't have the freedom to say, I don't like you because you're Republican or Democrat or black or white or gay or straight. It's like, we got each other, we got our backs, and we're going to love each other and help each other and trust each other. So there's something about that highly acutely stressful experience that facilitates bonding. That's an extreme example, and I'm not suggesting that education is like that, although it may feel like that. My point is that the stress that we're experiencing professional can be great fodder for bonding. So that's number 1, is have good community. Number 2, set good boundaries. And then, you probably heard that a million times, but just know when to say when. At some point every day, my wife and I, we look at each other, we shut our laptops, and we say, we're unemployed until tomorrow morning at 7:30 a.m. Like, whatever, let the world stop spinning, but I don't care. I'm not going to answer my phone, my text, my email, social media, whatever. I'm going to shut my laptop off, and maybe I just turn on Netflix and veg for 2 hours, whatever. I'm not going to do schoolwork. That has to happen every day. You've got to have that moment every day. And then number 2, you've got to have that moment every Friday where you say, how much of my weekend is sacred? No matter what, I am not going to be a school employee, maybe your personal life. Okay, sorry about that. Go to the chat and say we got you. I want to make sure that, okay, all good, cool. So let's go back to the slide then. I don't know why I keep getting bumped off. Practice, appropriately express emotions. We'll pick up there. But I'm not going to go into detail because I spent a whole hour. We spent an hour together talking about, emotion and what it does and how to regulate it. But the bottom line is that if I go to my workplace and act any kind of fool because I think I'm entitled to, because I'm stressed out, I'm overwhelmed, I'm angry, well, I'm also the adult and I need to be able to manage. Yes, I have the freedom to experience, to feel what I want to feel, but I have the responsibility to manage it effectively. And I don't just get to say, well, that parent pissed me off, well, I don't like my director, that's why I'm being crabby and gripey and catty. Like, no. You get to experience your emotion. That's your freedom and your responsibility. And my responsibility is to manage it effectively. Number one. And then number two, practice extending and requesting forgiveness. Let me get back to the PowerPoint. Practice extending and requesting forgiveness. This is so huge. So here's the deal on forgiveness. And my favorite definition of forgiveness is this. Forgiveness is surrendering the right we think we have to punish someone for the harm they've caused us. Forgiveness is surrendering the right we think we have to punish someone for the harm they've caused us. That's what forgiveness is. It's saying, you got me, you hurt me physically, psychologically, whatever. Man, I'm going to get you back. And the way I grew up is like, I'm not just going to get you back. I'm going to come back double. So you'll know you never want to do that again. It's all about vengeance. Forgiveness is saying, and I've got the right to do that because you hurt me, an eye for an eye, a tooth for a tooth, but I'm going to surrender that right. I'm just going to lay it down. That is so stinking hard to do. Forgiveness is okay. Sorry, I don't know. I've never been bumped off like this before. Somebody go to the chat and tell me where we were. Snowing here in Segovia. Oh, man, forgiveness. Okay, yeah, forgiveness. So unforgiveness is about retaliation, and if the person that forgiveness is surrendering the right you think you have to get even with somebody, and it's so important because what if the person that hurt you is not around? Well, if that person is not around, let's say they died or they live on the other side of the planet, whether you realize it or not, you're going to want to get even still. And person that looks like that person, that acts like that person, that reminds you of that person, that sounds like that person, they're going to have to pay rent on what they did. So let me give you an example, several. Let's say that at some point in your life, you got thrown into the bus and you were hurt by a middle-aged Mexican-American man with a lot of education and a lot of tattoos, and he did you wrong. And you're, I'm mad, right? I worked with him or I worked for him or whatever. And you haven't forgiven him. Yes, transference is what this is, displacement is what this is all about. Then, and I show up, right? 10 years later, but you still got beef with that other guy. Well, guess which middle-aged Mexican-American tattooed educated man gets to pay rent on what he did? It's me. You don't realize it, but you're going to bring, and that's called bias. That you're bringing that bias into your relationship with me. So you've already judged me for something I didn't even do, but because I remind you of that, then I'm back. I'm a few steps back. So, and you see this all the time in media when people say, "Don't trust him. He's a man. Don't trust her. She's a woman." Don't trust them. They're gay. Don't trust them. They're straight. You can't trust them. They're Republican. You can't trust them. They're Democrat. What that means is somebody in that group burned you at some point. You got it in your mind that's bad. And now you're going to label everybody. You're just going to lump everybody in, when in reality, some Republicans are actually very nice people. Some of them are idiots, but some of them are nice. Some Democrats are actually very nice people. Some of them are idiots, but some are nice. Some gay people are actually very nice people. Some are idiots, but some are nice. And you could go through any demographic variable. But as long as you're just, characterizing with these broad strokes, you remind me of the person that hurt me, so you must be bad. That is called bias, and it just puts people at a disadvantage. So this thing about forgiveness, it's so important because over the last 2 years, we have made many mistakes. We have made errors of omission and errors of commission because none of us knew what we were doing. None of us did. No one could say, well, back when I was a kid, this is how we did our pandemic. No, nobody could say that. So we made a lot of mistakes. We hurt each other. We disappointed each other. We frustrated each other. If I'm still bitter and carrying all that resentment with me, then the rest of the world has to pay rent on that. So forgiveness is just about saying, you know what? That person hurt me, but I'm going to let it go. I'm just going to surrender the right I think I have to punish them. And that way, nobody else that looks like them or acts like them or reminds me of them has to suffer from my bias, from my own issues. So that's why forgiveness is so, so important. If you've been hurt by a student, a colleague, a parent, an administrator, please forgive them for your own good and then for the good of everybody else that you love. Okay, let's go forward. Financial well-being. Number one, identify the external factor that impacts your relationship with your money. Very simple, very simple. It's called a budget. Do you have a budget that really accounts for all of your expenditures? And it's third grade math. You add up everything you spend at the end of the month, you get a number. And the goal is for this number of all your expenses to be smaller than the number on your paycheck. That's it, third grade math, called having a budget. So if it's that easy, why then is it so hard for us to stick to our budget? Like me, the numbers look good on paper, but why at the end of the month is it not working? Well, it could be because of the internal factors. And that is your psychology of money and materialism, most of which was established in your family of origin. What did you learn about money growing up? Like, did you learn, like I grew up poor. And so the mantra I got was money is evil and don't trust people that have money because they're bad and they did evil things to get it. And that's not true. It's not true. There are some people that have money that are idiots. And there are some people that have a lot of money and they are the most beautiful people in the world, They're as beautiful as anybody else. They're wonderful. Money's not evil, Did you grow up thinking unless you dress a certain way, unless you ride a certain car, live in a certain neighborhood, you're not worthy, Did you learn to use money to medicate your emotional pain? Go to the mall and spend, go to Amazon and click. That's the underlying psychology of money that makes the budget not work. The budget is simple. Sticking to it is not simple because of our internal factors, our internal psychology. So if I want to be well financially, 2 keys. Number one, identify external factors. So get a budget together. Number two, identify internal factors. That's what is your psychology of money? Spiritual well-being, link your decision-making with life values. And when I talk about spiritual well-being, I'm talking about it from a pretty broad perspective. So I think of spiritual well-being as sort of as existential well-being. I think that even for people whose worldview does not include the present if you're an atheist, if you don't believe in God, life, your rituals, your rhythms, your routines, why are you here on this planet? What do you value? What is meaningful to you? What's your purpose? All of that is part of, broadly speaking, spirituality. So to be well in that area, find people who believe what you believe, share your life with them, and then I would argue too, well, let me talk about that one, share your life with like-minded individuals. If you're Christian, find other Christians to live your life with so you can ask questions like, what does it mean to add value to the world and be a Christian? What does that look like in education? what does it mean to add value to my marriage and be a Christian? What does it mean to add value to my children and parent them as a Christian? If you worship in Islam, what does it mean to worship in Islam and add value to my role as an education? No matter what your jam is, whatever truth-finding rubric you use, secular humanism, agnosticism, atheism, whatever it is, spend your time with people who believe the same thing so you can talk about those things. Like, how do we actually flesh this thing out and manifest value in the world around us using that ideology, whether it's religious or secular or scientific? And then I would argue too, this says spend time with people who like-minded. I would say also spend time with people who are not like-minded, who don't believe what you believe. I love that. So I don't really sort of identify as a Christian anymore. I still believe there's a higher power. I believe there's a force outside of us. I believe we can relate with that force personally. I believe there's truth in the Christian religion, absolutely, but I believe that's true of many religions. And then there's truth outside of religion, I believe. But what I love is finding somebody that, like, a diehard conservative, fundamentalist evangelical Christian. Like, that's so not me, but I love talking to them because it's like, well, tell me what you believe and challenge my thinking. I want you to challenge my thinking. I want to get deeper into this process. And it may be that even though you are not my jam, like, that's not what I'm going to do, you still might have truth that I don't. And I want to learn. If you're an agnostic or atheist and you don't believe in a higher power, let's talk, man. I need to learn from you. What do you know that I don't know? Because it may be that I'm the idiot in the room, and maybe you know something I don't. I want to learn from you. So wherever you come from, I want to talk about it, not so I can change you, but so I can change me. So that would be another thing to increase spiritual well-being. Physical well-being, practice good nutrition, get 20 minutes of exercise a day, and sleep well. Those are three fundamental pillars of physical well-being. Is just nutrition, and nutrition is the most important part of that. 20 minutes of exercise a day and sleep well. So here's the $1 million question. How well are you? What I want you to do is I want you to take about, let me look at the calendar here. I think we started, I want to make sure that I'm managing my time better than I did in the last session. We started at 3 your time, we end at 4 your time. So we still have 30 minutes. Cool. I want you to go into your work. I want you to go into your groups now, your breakout session. And I want you to say, I'm going to put this wheel up one more time, and I want you to share with the group what feels like it's the strongest part of your overall well-being. Like, where do you feel like you're really doing well? And then what is your secret? How are you maintaining wellness, into a school year secret, whether it's emotional, financial, spiritual, wherever you feel like you're doing really well, share that with the group. And then share what is your secret, what keeps you going in that area, so that we can consult with each other and learn how to learn strategies from each other. And then the last thing is in your conversations, let's start with a person whose birth date is closest to 4th of July. Whoever has a birthday that's closest to 4th of July, you go first. Okay, so go to your groups and share with each other, where are you killing it and what's your secret? All right, my friends. Let's bring it back together. I know we had some technical issues getting everybody into breakout rooms. I apologize for that. Go to the chat and say I'm here, and that way I'll know I can move on, and I'll spend our last 15 minutes. There we go. Okay, cool. Thank you, William, Angela. Good, great, Vicki. Thank you. Awesome. One thing I want to do before I conclude is I just want to let you know about this website that you're going to have access to. So let me flip over to my computer screen here. So the website, and you'll get this link. Let's in fact, I'll just go ahead and type it down here in the chat. Let's see, www. appliedeqgroup.com .thinkific.com. Not dot. Okay, hold on one sec. Hold on, I'm almost done. There we go. Okay. appliedeqgroup.thinkific.com. Okay. So that's the website. And you'll see here that hold on one sec. I'm still adjusting. There. This is the website that has some of my courses on it, and you're going to have access to this for free. So these are the courses. So like how to navigate stress like a hero. That's about stress management, trauma and learning, how to build relationships that work. The mind series. These are all stress management series, how to stretch your body, how to breathe, conflict and communication, the stages of escalation. I talked about that earlier. So you'll see these courses here are $75.99 each, but you're going to get a code that will give you access to everything for free. Now, the one we're talking about today is holistic well-being. This is like loving myself well. And so if you want to go back and you know, take a deeper look at this, there's an assessment on here that you can take that lets you know what your wheel actually looks like. It's there for you. So anyway, I just want to make you aware of that you will have this additional resource to you. When you take these courses online, each one is about an hour. When you take them online, hold on, I'm all blurry there. Let me see if I can focus in. There we go. When you take it online, someone's asking how long were you able to access them for no fee through the summer. So you'll have a good while. There are some mastery tests along the way, you know, to make sure you're paying attention. But when you're done, you will automatically be issued a certificate of completion so you can document CEUs. So I just want to make you aware of that before we end, because I only have 15 minutes left. So I think it's a great way to keep the learning going. Now, let me get back to the PowerPoint. The assessment that I'm talking about, and again, all of this content, including the assessment, is in this book, The Power of a Teacher. But this is what the assessment looks like. Let me show you here real quick. So this is occupational well-being. Number one, I'm able to let go of frustrating or challenging situations over which I know I have no control, and those situations do not steal from my enjoyment apart from my life at school. And you're going to mark true or false. Is that true of you or not? Number two, I'm confident in my knowledge of my content area and my ability to teach it. True or false? Number three, I'm generally satisfied of my knowledge of content, or I'm generally satisfied with my vocation as an educator. True or false? So there are 10 questions here. You're going to go true or false, and then you're going to total your number of true responses and put it here. And again, this assessment will be available in that video that I showed you online. Next area is emotional well-being. Same thing. 10 questions about emotional well-being. Total your responses. Next category, financial well-being. Next category, spiritual well-being. Next category, physical well-being. Then you're going to take the total number of your true responses from each of those 5 categories and bring them over here onto a wheel. So you'll put your scores down here, all the true responses, and you put like 10 or 8 or 3 or 1 or whatever your number is. You do that. And then you plot them on this scale. So if you scored a 5 on emotional, you'll put a dot right here. If you scored a 10 on financial, which you probably didn't, you'll put a dot right there. If you score a 5 on spiritual, you know, so you just plot your data on the wheel and you connect the dots. And that's how you see what your wheel looks like. So let me go back to the PowerPoint and kind of show you what it means going back to this wheel. So this person here, the green wheel is like, that's you scoring a 10 out of 10. So you're killing it, right? But the red wheel is like, oh, you're not doing so well on occupational. Maybe that's a 4 or a 5. Emotional is a 6 or a 7. Financial is a 2 or a 3. So anyway, just to give you a sense of what that looks like. Okay. The last thing I was going to do, but I don't want to go into it because I'm not going to do it justice. There's just too much information and you're going to have access to it anyway. These are just recommendations to start growing well-being. Like, so for number one, occupationally, reach out to a colleague that is struggling and just listen to them. It's a great way to build community. Next one, discuss your evening routine with your family and just ask as a family, like, hey, what boundaries do we need to put in place? Like, we've been school district people for 20 years of our career. And we told our kids early on, you're not going to get the best of us until Labor Day, until after Labor Day. But if we're still in this mode where we're working too much after Labor Day, you let us know, because you are not, the school is, our work is not more important than y'all are. You've got to be the priority. So just have an honest conversation with your family or whoever you go home to, and just ask, what does boundary need to look like? So those are recommendations for occupational well-being. There are some for emotional well-being here. And again, I don't have time to go into a lot of detail. Financial well-being, spiritual well-being, and physical well-being. So again, just practical strategies, things that you can start doing right now, today, to grow well-being in your life. Okay, great. So we have about 10 minutes left, and I want to pull the lens back out and go big picture, going all the way back to this morning. So bear with me, and I am going to I'm going to pull up that PowerPoint real quick and review very quickly what we've covered. So remember, when we started this morning, we started with this. It was me freaking out that I'm so far south and you are so far north. We did my little geography map. But my main goal was, number one, I wanted to encourage you. And I shared my story and my daughter's story and my grandson's story with you, just to give you proof that what you do doesn't just matter. It's going to matter for generations to come. The young men and women that are pouring into your classrooms, they have high needs, and it's a lot of work. It absolutely is, but it is so worth it. It is so worth it to take care of yourself, love yourself well, and stay in the game. It doesn't just matter. It matters for generations. Be encouraged. Number two, I wanted to equip you, and I just wanted to add a couple more tools to your tool belt. And all of that was in the realm of emotional intelligence, understanding emotion, understanding your life wheel and how to grow well-being in those areas, understanding escalation and knowing, what do I bring to the table when there's an escalated situation that helps or hurts. All of that is internal roadmap stuff. It's all EQ stuff. So I hope through this that you've received some practical strategies, things that you can start doing right now to grow well-being, to increase your emotional intelligence, which ultimately will increase your sustainability in the classroom. Cool. So what we're going to do now that we have our last few minutes together is I just want to give you a chance to ask me any questions about anything from any session I've given today. It could be about my life, my journey, my childhood, my journey in trauma, mental illness, any of the content, just free form. I want to give you 10 minutes or 8 minutes, actually, now that I look at that. So what questions do you have for me? Yeah, man, it's great when students come back and give you that feedback. Absolutely. Absolutely. Yep. I agree with you, Rachel. 100%. And you can also feel free to just unmute yourself if you have that ability. I did let both of those teachers know. Well, one of them, sadly, the one of them, Miss McRoberts, passed away from cancer in the 90s. So I never got a chance to go back and thank her, but just to give you a sense of who she was in hospice care. Like, she was living out her last days, and she would make her hospice nurse put her in a wheelchair and take her up to school so she could check on her students in high school. And she just shared her death with her students in a way that was just so beautiful and so dignified and so calming. She was just an amazing woman. Miss Exley, my English teacher, I did go back and I met her. I went to that elementary actually to present, and they invited her, and she was there. I hadn't seen her since the 80s. I mean, it was really surreal. And I was so scared and so nervous. And I thought, man, Adam, you better not suck today, not with her in the crowd. So it was really good to connect with her. And yes, I did let her know. Contact with bio mom, foster family, yet more foster family than mom. My foster parents were both teachers, not surprisingly. And they're just incredible. They're 75 now. And they're still teaching. They wake up and they go to school. And, you know, I asked my foster dad one time, like, oh, so when are you going to retire? And he's like, retire and do what? Like, what else what could be a more valuable use of my life force than to do what I'm going to do it as long until they have that, like, if they can't get me out of the house and go teach, then this is what I'm going to do. This is who I am. So they're amazing. Not much contact with my bio family. It's really, for me, it feels real toxic. So I just avoid it. Do I ever think mental health services in school is heading idealistically, realistically? I think we're moving in the right direction, but honestly, as sad as this sounds, I don't think it's got bad enough to get the right people's attention. Too many people are still in denial and thinking like there's no such thing as mental illness. People that are depressed are just choosing to be depressed. We need to keep up with the Chinese on math scores. I mean, all of that stuff, to me, it's just heartbreaking. So I don't know where we're headed. We're sort of moving in the right direction, but I think as soon as we get better, that they're gonna forget about it. It's sort of like that thing about the monkeys that they don't fix the roof on the hole in the roof in the summer because it never rains, and they can't fix the hole in the roof in the winter because it's raining. And so it feels like we're sort of in that game with mental health. If we take your courses you're proud of, will you be able to contact with you? Questions? I will not be available. Thank you, M. Martin CH. Trying to say that. It's going to call you Martinch, but that's probably not your name. Chelsea, thank you, Chelsea. Chelsea Martin, there we go. You won't have contact with me, but man, yeah, build a group around it. Like get a group of people together and watch a video and do some self-study, you know, create a day of PD and you watch videos and you talk about them. I'd be happy to, you know, if you think your district might benefit from me on site, I'd be glad to talk about what that could look like or do a virtual training. Absolutely. But no, I won't be available for further follow-up. Teal Rintala, sorry, says, this is so refreshing to listen to you. Thank you so much. That's so kind of you to say that. It's always, when I get to work with educators, man, I really, really mean it when I say it's life-giving for me. I just can't think of a higher honor as a psychologist to do everything in my power to make sure that you are as relationally successful with your students as my teachers were with me. I mean, this is an honor and a joy for me. So thank you. I appreciate you. Cool. All right, y'all. Well, I guess that's all I got. And I am going to leave you with this image, reminding you and reminding me that you do have power to calm the storm within. It's called emotional intelligence, and you can do it. So proud of y'all. I so appreciate y'all. I love you guys so much. Be good to you because you're worth it.